It is quite serious and is getting worse. It's like living through an earthquake, a long-lasting, ongoing earthquake, where you can see what is going on and you cannot yet understand when it's going to stop. Certainly, it started as a public health crisis and affected people particularly because they were losing lives and losing loved ones. So it was a public and human tragedy in terms of health. But then gradually it is becoming a crisis that is also socioeconomic in its nature. And as usual in these cases, the most vulnerable, the poorest, are affected more. The crisis affects a way of living, a way of working. The country is now under a state of emergency with the curfew, with restriction in the transportation and possibility of moving around, with the civil service on administrative leave. This has consequences on the services that are provided, the quality of the services, the speed of the services, or the availability of the services. We're talking about other health services non-Ebola related. We are talking about administrative services, but also we're talking mainly about the disruption in the commercial and economic life, from farming to business to services. There are huge losses already being recorded. The country is losing points of GDP. It was one of the fastest growing economy in Africa until the Ebola outbreak. And now we find that people are losing livelihoods. If they are self-employed, if they have, even if they are working in the informal sector, there are less and less opportunities. Prices are increasing, and particularly food prices are increasing, so it becomes more difficult for households to meet their needs. At the same time, concessions that are so important in the country, forestry and mineral concessions, are either slowing down or closing or stopping activities altogether, with the risk of laying off a large number of people. So a lot of people are losing their earnings and their way of sustaining their families. In addition to that, because the government is losing tax revenues for the slowdown of the economy, they have less resources to both face the Ebola crisis as well as to support, for instance, the public service. So obviously this crisis is now affecting all ways of living, all sectors of society, and is no longer a public health emergency only. The huge needs, and as I was mentioning, do not necessarily affect only the health sector. Of course, the priority is to contain the spreading of the disease, which involves providing health care to those affected with Ebola, and also to prevent further transmission and isolate the cases of contact with the people that have fallen sick. This is priority number one, but it doesn't stop there, because one has to also restore the possibility of livelihood for families, communities, in all the counties of the country, in rural and urban areas. One characteristic of the Liberia outbreak is that the capital city is quite affected. It is the place where the highest number of cases has been recorded so far. So definitely the health emergency has to be faced as a health emergency, while at the same time livelihood are restored and people do have support and safety nets to continue to go on with their life and access higher priced goods and services. Several things. In addition to the classical role of coordinating the UN system support, also strengthening the capacity of the government to respond, and we have put in place a number of what we define as quick impact projects together with other UN partners, which means moving means of operational and logistical support to each of the 15 counties in Liberia. In each county there is a health team, an Ebola health team that is working and providing support, strengthening health facilities, creating isolation centers, supporting families, providing supplies and protective gears, for instance. So all this is being done by making sure that resources are available to each of these teams. But we are designing fundamentally a system of safety net. We need some social compensation scheme to compensate for those that will lose their jobs, their informal occupation, or their livelihood in the rural areas on agriculture or on services. And this has to be done probably with cash transfer in the situation we are now to support the poorest family and the family of those affected. Also, there may be a point where the government is unable to pay the salaries of the civil servants, that the concessions will not be able to sustain salaries once they have ceased activity for months. So there will be a huge number of people that need livelihood support, possibly cash transfers, for a number of months until when the local economy and their livelihood can be restored to a normal rate. Let's not forget, this is not a rich country. Although the progress made was impressive over the last years in economic terms, there is still a huge proportion of population that live below poverty lines. And therefore, we are now facing an aggravated situation and not only a pocket of affected people. It's very difficult to predict. It depends on how effective the communities mobilize themselves, how effective the community outreach will be. It is necessary that community teams of volunteers or young people help in identifying, isolating the cases, as well as spreading awareness and the right messages. Ebola gets transmitted through social interaction a lot. It gets transmitted in the health centers, unfortunately, and also through contagious contacts of the with the medical staff, but also in burial and traditional ceremonies that surround the burials, for instance, and out of ignorance or denial, which still exists, although is decreasing in the country. And therefore, behaviors have to be modified if we have to stop the transmission from person to person, from family to family, from community to community. Just decreasing movements of people in the country will not make the trick. Just treating people in the health centers will not stop Ebola. Ebola will have to be stopped in the communities. So priority number one is get communities much more involved in managing the crisis and ensuring stopping the spreading. And also we need to start putting the basis for some form of economic recovery. Ebola, I said, is like an earthquake. When the earthquake stops, we'll have to see where are the rubble. Where is the rubble? Where the landscape, the socioeconomic landscape, the social fabric even, will have changed by then. So the vulnerabilities will be modified with respect to the pre-existing situation. So, but we have to start thinking now on how to reactivate the self-sustenance of people, their livelihood, their occupation, their access to jobs, to microcredits. So this is something that has to start now to be prepared when the moment comes. What is for sure is that Liberia is, unfortunately, like the other countries affected, going to lose years of development progress. Unfortunately, this will roll back the human development by several years, and this is the saddest truth. It's not only the human cost, but also the development cost of the crisis. The message is the crisis is serious. It's serious and is not solvable in a few weeks. Therefore, a much higher support is required. The financial as well as the human resources support has to be scaled up several times. Let's take the case of medical staff. They normally can sustain those jobs for a period, for 2-3 months. And since the crisis is going to be longer, we need also turnover, and it's already hard enough to mobilize sufficient number of health personnel to come and assist in the situation. The country has very few medical professionals and assistants. Second, budget support is required and means for the social compensation that we see coming, the need of which we see coming is quite required. I believe that still there is not the exact perception of what is going on in the countries affected by Ebola. This is not a post-disaster situation. This is a disaster in the making. and therefore we still have to see the full consequences and the full extent of the damages. And the support is needed now, because the sooner it stops, the less costly in human and financial terms it's going to be.